I'm one of the physical therapists at Cornerstone Physical Therapy. Today I'm going to talk to you about neck pain and headaches. I'm going to give you some background information of causes of neck pain and headaches and give you some basic things that you can try at home to help with some of your pain, but also give you some other options as far as whether to come into the clinic or see us online. Just a little bit about me. I graduated from University of St. Augustine in 2001 and pretty much have been in private practice my entire career. I've worked a little bit in some nursing homes and some hospital settings and stuff, but the majority of my practice time has been in general orthopedics. About 2005, I began to start working more into the head and neck area, and that is about 70 to 75% of the patients that I see in the clinic. In 2012, I completed a dry needling certification, and I also completed my doctorate because at the time that I graduated from St. Augustine, it was a master's level. We had changed to a doctorate, and my doctorate is actually in head and facial pain management. So I've taken some extensive courses in trying to learn more about how to treat this area because it can get quite complex. So a little bit about the facility. Cornerstone Physical Therapy is a company that has been around in North Carolina since 2008. We have 3 locations in Arden, East Asheville, and Woodfin, North Asheville area. We have multiple types of subspecialties that we do. We treat the general orthopedic population, but we also have therapists that subspecialize in various disorders such as lymphedema, pelvic health, head and facial pain. We do weight training injuries, rock climbing injuries, different things like that. And then in our Arden office at this time, we also offer massage therapy by licensed massage therapists. So the cervical spine is going to give you a little brief anatomy review or even just an introduction depending upon your background. There are 7 vertebrae in the cervical spine. Each have a connection where the 2 vertebrae come together, and that's called a facet joint. What the facet joint does is it helps glide. It helps with movement, and they're positioned at about a 45-degree angle in that part of the neck from about C2 down to about T1, T2. When we look at the cervical spine, we look at it in 3 different zones, I guess you can say. In the first zone, we have your first 3 cervical vertebrae, one being the base of the skull. The middle cervical spine, that's where the majority of our stability comes from. And if there's any injury to that area, it affects the stability and could turn into pain and problems, which we'll talk shortly. And then we go into the cervicothoracic junction, which is where the cervical spine transitions into the thoracic spine. And that area is of particular importance for when we are dealing with upper back and shoulder issues. So the neck anatomy, muscular-wise, as you can see here, there's a lot of different muscles, and we're just touching the surface here. The main thing I want you to get out of this slide is that there are a lot of muscles in the neck that help hold your neck, but also help move your neck. Injuries to any of these areas can result in dysfunction and improper movement. And anytime we improperly move, that's going to increase risk of injury or further injury. The other thing I want to highlight is that these muscles all have referred pain patterns. And what a referred pain pattern is it's when you have an injury here, but you may feel it up here. Okay? So as we go through these slides, I want you to think about where your pain is and kind of look at these muscles and say, hey, wait a minute, that's where my pain is, but that's not where my problem might be. And one of the things that we do in the clinic is we look for the problem instead of just dealing where the pain is. There are also a various number of nerves that go through the neck. There's a cervical plexus in the upper part of the neck, and then in the mid part of the neck, there's something called the brachial plexus. And those are nerves that come out of the neck and down into the arm, and they provide a lot of information and motor control to the arms. The cranial nerves, they deal with jaw motion, sensory, but also how your eyes blink, how your eyelids blink, and all those different facial muscles. So they control more of the head and front neck muscles. So what exactly is neck pain? The dictionary calls it a sensation of discomfort in the neck area. I think that's kind of a basic definition, but I think neck pain can be determined or even defined by you a number of different ways. And there's a number of different causes, as you see here. We have disc pathologies, which we'll talk about in a couple of minutes, but I think that's the one that people are very alarmed about. And I'm hoping that as we go through this, you'll see that disc pathology is not the end of the world. It's just another cause. There's also temporal mandibular dysfunction, and that's pretty much dysfunctions of the jaw, popping and clicking with locking and pain. So if you're having problems opening up your mouth or while you're chewing, it gets stuck. There are different causes of temporal mandibular dysfunction that derive from the neck, and there are some temporal mandibular dysfunctions that derive from the jaw, and we'll have a separate webinar on that. There are muscle imbalances and strains. Muscle imbalances or strains could be from habitual positioning, whether it be something that you do at work, an activity that you like to do, or sleeping positions. Facet entrapment, that's when, again, we talked before about how that 45-degree plane of the facet joint, there's a capsule that goes around it, and that's what helps hold and guide and give nutrition to that joint. Well, sometimes that facet can get entrapped, and that causes pinching and irritation. And we'll talk about that shortly as well. There's whiplash injury, and then there's chronic headache issues. So we're going to go through a little bit about disc pathology. So as you can see here, this is an MRI, and that's showing a disc herniation of about C4, C5. And as you can tell, there's a little bit of compression on the spinal cord area. Again, this is something that we look at, but we also want to look at what other pain issues you're having. It is not just the disc that is causing your pain. And in a lot of cases, it may not be the disc at all. It may be that there are other issues that are causing your pain and that the disc pathology is just a finding. Okay, so the only time that I consider a disc an issue is when the disc that is herniated, that's compressing on a nerve, is actually relaying the symptoms that the person is specifically telling me or complaining about. So if your symptoms do not correlate with the level of disc issue, then I just find that more as benign. And the reason is that 40% of people with disc pathology are asymptomatic. So 40% of people out there have disc issues somewhere in their spine, and they have no symptoms. So what we need to do is we need to be making sure that if you have positive MRI findings or CT scan findings or X-ray findings, we need to be making sure that they actually correlate with the symptoms that you're having. Okay? And we do know that the outer disc can heal over time. There's blood supply to that disc. So what we want to make sure is that, number one, are the findings for a disc pathology in line with the symptoms that you have? And then number two, is there a way that we can work with you to allow that disc to heal over time and get you stronger and more stable so that we don't have problems in the future? Muscle imbalance and strains. The biggest thing I want you to understand with any kind of muscle imbalance and strains is that when our muscles are irritated, when they are overworked, they tend to develop trigger points. And what trigger points are areas of local hyperirritation that cause further dysfunction of the muscle. So it's pretty much in basic terms, it's a knot. So anytime you kind of press right here and you're like, oh, I feel that little knot, and you're like, oh, that hurts, that's a trigger point. And that's a source of dysfunction. It'll either inhibit, which means make the muscle not work as hard, or it'll overexcite, meaning that the muscle is working harder than it should be. And both sources are a sign of dysfunction. In the case of the weaker area, is that muscle's not recruiting enough muscle fibers to generate the amount of force that is needed for that muscle to work efficiently. And that can cause strain and dysfunction. On the other end, you have an issue where the muscle is overworking, and now that muscle doesn't have a chance to relax, and it doesn't have a chance to get properly bathed with blood to help release the different metabolites that occur in the body as the muscles work. So what can cause different muscle imbalances? Well, there's posture. Now I want to just make sure that we understand that bad posture alone does not contribute to neck pain. It is usually a combination of things. Posture is an influence on neck pain, but it does not mean that if you have bad posture, you develop neck pain. But if you have neck problems and you go into bad postures, it will exacerbate your symptoms. So as you can see with this picture, a lot of us are using smartphones now, but we're using our heads in a very hyperflexed position. So as you can see in the picture to the right, at 60 degrees, you're putting 60 pounds of additional pressure on your neck. So as you can tell, one of the things that you can do, especially if you have chronic neck issues, and this is good even with a smartphone or just if you're just reading a book, just get that book up closer to you and reduce that angle on the neck to reduce the tension. So what other things should we be looking at? The way we sleep, the way we drive. So a perfect example is when you're driving, you should not have to give yourself whiplash in order to see the mirrors. You should be able to look at the mirrors. So if you have your rear view mirror here and your side view mirrors, you should be able to see all of your mirrors without moving more than 30 degrees in either direction. When you're working at your workstation, you want to make sure that the middle of your monitor is eye level. You want to make sure your feet are flat on the floor. You want to make sure that your computer is set up in a more ergonomically efficient position to make sure that you're not putting additional stress and strains on your neck, on your mid-back, on your low back. So what can happen if we develop imbalances? Well, typically, the muscle will become irritated and highly sensitive. And again, we refer to that as a trigger point. As you can see here, the sternocleidomastoid, which is the muscle right here, has a wide array of pain spots. You have the back of the head, you have the ear, you have above the eye. So just because you're getting a headache here doesn't necessarily mean that the problem is right here. It could be here. Upper trap, that's this muscle right here. The muscle comes all the way along and it attaches to the base of the skull. So any kind of irritation along those muscles can generate pain in various areas, as you can see. The inferior oblique, this is a muscle that it's not that big, but is a rotating muscle positioned at about a 45-degree angle in the upper part of the neck, right back in here. This is a main contributor to headache symptoms. I get a number of patients in the clinic who have pain along this area that wraps around the eyebrow back into the ear area, and that headache is from that muscle, and in a lot of cases, especially after a whiplash injury, that muscle can become irritated and weak, and without specific training, specific strengthening, it's very difficult for that muscle to recover. The scalenes are the muscles in the front of the neck. They're right next to the sternocleidomastoid. And as you can tell, there's a wide number of different referred pain patterns that are nowhere near the area of irritation. And the reason is because your brachial plexus, which is some of the nerves that I spoke about earlier, run through that area. So if you have a dysfunctional scalene, not are you going to have problems with that muscle, but you're also going to have problems with the nerves that go down the arm. Again, if you have some symptoms going down your arm and your MRI is showing a herniated disc, the herniated disc may be part of the problem, but the other part of the problem could be some other muscles that are causing entrapment. And they refer to that as a double crush syndrome. And pretty much what that means is that you're getting entrapped, the nerve is getting entrapped along the line of the nerve. And a lot of times, if we can clear out a couple of those points, so let's say the scalene and the pec muscle, we can reduce the symptoms enough to where now the impingement in the spine is no longer as irritative as when all 3 points are entrapped. So we're going to move into cervical meniscal entrapment. This is one of those that are fairly easy to treat in the clinic, but it is very painful when a person has this. It's an acute onset of pain that prevents multiple directions of movement. So most of the time, this is a situation where someone wakes up in the morning and they can't move their neck. And they're like, oh, and anywhere they move, they are in a tremendous amount of pain. As you can see in this picture, the folding of that capsule goes in and impinges into the facet space, and it causes a lot of swelling and irritation. And so what happens is that the person has severe pain, can't move, and they don't know what to do. Well, the good thing is that in a situation like this, you can come into our clinic, and within a couple of sessions, we usually have some fairly good success at getting that meniscal entrapment to resolve and getting movement back into the neck so the person can move around and not feel like like they're all locked up. And these heal up fairly quick if we can catch it early, and if we can get the person moving in a non-pinching, non-pain movement pattern. Typically, these will sometimes resolve on their own in 7 to 10 days, but I'm not sure about you, but I don't want to be in pain for significant pain for 7 to 10 days. In a lot of these cases, we can clear these things out and help people feel more comfortable in a rather quick period of time. So it's better to get treated and not be uncomfortable than to be uncomfortable and then, probably will get better in about 2 to 3 weeks anyway. Whiplash is one of those things where we have a big problem with it not being looked at in the manner that it should be, in my opinion. We don't treat whiplash as a problem. A lot of times people will say, oh, it's whiplash, you'll be fine. It's just soft tissue injuries. But there's a lot of different things that occur during a whiplash injury that can have chronic long-term effects. The majority of whiplash will heal on its own and people have full recoveries. But there's a subsection of the population where these whiplashes do not respond. They do not heal well. And what they find is in MRI studies is that the deep stabilizers of the neck, the longus colli and the multifidi, longus colli is in the front, multifidi is in the back. Those muscles actually will atrophy and not be able, and they lose the ability to stabilize the spine from the front and the back. And those are muscles that need to be trained specifically in order to recover. They do not spontaneously recover on their own if they're injured. So in these cases where you've had whiplash injury and you've had chronic neck pain now for 6 months, a year, 5 years, or more, a lot of the reason for your pain, even though because your MRIs are going to be clear, your CT scans are going to be clear, your x-rays are going to be clear, and they keep telling you it's soft tissue injury. And they're right, it is soft tissue injury, but it has to be retrained. It has to be worked on. And there are some basic things that we can do with this, but these are things that have to be done in the clinic. But I have seen people do very well with our stabilization program. And what I want people to understand is that this is a treatable condition. It is not something that you just have to live with. And it's not something that we should just pass off as a soft tissue injury, okay? So what are the symptoms of whiplash? It's neck pain and stiffness, loss of range of motion, headache, fatigue. Some of the other things that we see is positional dizziness. So if you get up too quick, or if you sit down too quick, or if you move your head a certain way, you get dizzy. Sometimes we have jaw problems associated with it. If you are suffering from a whiplash injury, and it's been more than 4 to 6 weeks, I would strongly encourage you to seek treatment from a qualified physical therapist, because I definitely think that it becomes more of a motor muscular issue, and it's something that we can help you out with. So again, talking about the unresolved whiplash, it's a third of the population, and it does deal with the deep cervical stabilizers. With specific training, we have shown pretty good success. Temporal mandibular dysfunction, I'm just going to quickly touch on this. Again, we were going to have a separate webinar regarding this because it's much more complicated than just opening and closing your mouth. But what I do want you to understand is that temporal mandibular dysfunction, if I remember right, the statistics are 75% of people with a neck dysfunction have an associated temporal mandibular dysfunction. 93% of people with a jaw problem have a neck dysfunction. So as you can tell, those are two very interrelated issues. But I want you to remember that if you have a joint problem, or if you have pain in your jaw, but you don't have any neck pain, that doesn't mean that you don't have a neck problem. There's multiple times where I've treated patients where they only are complaining of facial pain. We work into the neck and they find stuff that they didn't even know was bothering them. So headaches can really be a pain in the neck, because in a lot of orthopedic type driven headaches, and I want to make sure I'm clear on this, these are orthopedic driven headaches. These are not vascular, these are not neurological headaches. vascular and neurological headaches are not treated by physical therapists and should be referred to a neurologist or a vascular surgeon or someone else other than us. We do screen out for those things. According to the International Headache Society, I believe that there are 15 different headaches. So we screen that out, and if we do not find an orthopedic-related condition for your headache, we will help you find doctors that will be able to help you. We do work with doctors throughout the region. And so, but in this case, headaches can be a real pain in the neck because in most cases, these orthopedic-driven headaches are due to chronic neck issues. So as you can see, there are multiple types of headaches, again, going into the neurological, going into the vascular, but also going into the musculoskeletal, head positioning, chronic imbalances of the neck muscles, and so forth. There's a number of different things that can cause these types of problems. So we need to kind of look and see, is it coming from the jaw? Is it coming from the head? Is it coming from your mid-back? There's a muscle in your back right back here called your rhomboid, and in some cases we've had that where people have said that it's referred up into their head. So what are causes for headaches? In most cases, from an orthopedic standpoint, it is an inability for your body to function correctly. There's imbalances, whether it's muscular imbalances, joint imbalances. I've had people come in where the right side joints of their neck are really stiff, but the left side moves fairly well. And so when they try to move, they can move fairly well one way, but they kind of get stuck in the other. Okay, and that creates repetitive injuries and repetitive irritation, and then triggers headaches. So before I get into this, I just want to touch, there are a couple of different headaches that I want people to understand that we can treat. So there's tension type headache, which is more muscular in nature. There's cervicogenic headache, which is pretty much meaning that the headache derives from the neck. A temporomandibular headache, which derives from the temporomandibular joint. And even some types of migraine can be treated with physical therapy. The other ones, like I said, we refer out. So what can I do about my pain? Well, if you continue to just have pain and you don't do anything about it, then you're ignoring it. And what you're going to wind up doing is you're going to limit your lifestyle. And in the case of the jaw, you'll limit your diet. In the case of your head, you'll because you're having so much headaches, you're going to start reducing the amount of time that you're hanging out with friends, socializing, exercising, and doing things like that. And the problem is that as we do that, and as we stop being active, we actually make our bodies weaker, which then makes us in more pain. And it becomes a repetitive cycle. So by ignoring it, you're actually feeding into the negative cycle that will actually make your symptoms worse. We can alter it or mask it. We can use injections. We can use pain medication. We can use TENS units. There are a number of different treatments out there, but the question is are you treating the symptom or are you treating the cause? And one of the things I really want to stress is that when you're taking medications, now these are for orthopedic-driven headaches. These are not for neurological headaches or anything like that, because those types of problems do need medications. In some cases, they do need surgeries and different things like that. I'm, again, talking about orthopedic-related headaches. Those, when you're taking medications, when you're doing injections, you are only treating the pain. You are not treating the cause. So the best way then, in my opinion, is to try to change it. Let's kind of look at how we can help you reduce the pain in your neck and improve your quality of life. By improving your quality of life, you're going to be out more, you're going to be more active, and you're going to reduce pain. The number one option out there for battling depression is exercise. It's better than any antidepressant drug out there. Surgery is only supposed to be used in last resorts, because once you've had surgery, you are now 4 times more likely to have another surgery, whether it be on your neck, your mid-back, or your low back. And again, the surgery will not fix the localized pain. All it will do is stabilize the area of disc herniation or whatnot, but it's not going to do anything to improve the strength of the neck muscles, to improve your mobility, and to get you functioning better. The other thing is that physical therapy has been shown to be a lower cost treatment option when performed in a manner that is kind of like symbiotic, where we work with the patient and the patient works with us on a good plan where the patient sees us when needed and then does things at home, changing lifestyle, being more active, doing the home exercise programs. It works very well together. It's not a one-lane road. You can't just come in here, have me work on you, and just go back to your normal things. But also, you can't just go out there and try and do it on your own because you've been trying that and it hasn't worked. So we need to have that relationship with each other in order to get that to work well. So what's included in PT? We do an individualized assessment. Your first hour, the first visit is an hour long, and we go through neck range of motion. We go through how you're lifting, how you're sleeping, all different things. And we try to figure out what is going on, what is causing your pain. Because right now, if you knew what was causing your pain, you would be feeling better. Because right now, you don't know. We spend a lot of time trying to figure out, okay, is it something that I'm doing at work? Okay, let's change your workstation. Is it something I'm doing when I'm sleeping? Let's kind of change that around. And we work with you because we make some suggestions. We have you go back, try it, and then we look to see if it works. I'm a big fan of sit-stand stations. I definitely think that it's something that everyone should do. Sitting for a long time has significant negative effect. So making sure that you have the ability to do a sit stand, or if you're using a laptop, again, making sure that that monitor is not the monitor that you're using on the laptop surface, because you're going to be positioning your head in a more look down position, which is not healthy, as we looked at before. But working in an environment that gets you moving and keeps you moving, and every 20 minutes or so, you should be getting up, moving around, and then sitting back down, even if it's just for 30 seconds, just to get the body moving again. This is not the desired sleeping position that we want. Sleeping on your stomach is very poor for a number of different reasons. We want to be sleeping on our side with a supportive pillow. The pillow, if you're a side sleeper, should go from about where that bump in your shoulder is to your neck. It should fill in this space and should be a medium firm to firm pillow. If you're a back sleeper, the pillow should be thinner and you can get away with a softer pillow, because you don't want your head driven up like this. You want, again, your head more in this position. So after we do some ergonomic assessment, sleeping position, all that thing, we go through some education, we do some more hands-on treatment. And our hands-on treatment is manual therapy. We'll do joint mobilizations, which is skilled passive movement to the joint. We'll do soft tissue mobilization, which is soft tissue work, massage, myofascial release. We do dry needling, which is the use of a solid monofilament needle, and we put it into the trigger point to release the trigger point, along with a number of other different things. And then finally, we will work with you on different exercises, depending upon what you need. Some people need more stability. Some people need more mobility. Some people need a combination of both. So we look and see what you need, and then we curtail it towards you, giving you an exercise program. I try to keep my home exercise programs for about 10 minutes or less to try and just keep you on a management maintenance basis after you're done with therapy. So what's our goal? Our goal is to reduce your symptoms and make you more independent so you can self-manage your symptoms and feel better and feel more confident going out and doing more things. My goal is to make all my patients more active, because the more active you are, the healthier you're going to be. So I'm just going to go over a couple of quick exercises that I give the majority of my patients, just as some general guidelines. If you want more specific things, please comment in the section underneath, and we can try and send you some information, or you can contact us and schedule an appointment. You can speak with Elise. Again, you can leave a message in the comments underneath, or you can call our office at 828-684-3611 and just follow the prompts to scheduling a new visit. The first one I want to go through is chin tucks. And pretty much what you're doing is you're just taking your head and you're sliding it back. And it's a slide back, not a roll down. That's a big mistake that people make. And all I'm trying to do is pull my chin back, and I'm stretching in here, and I'm working these front neck muscles. Just to start is a very basic. It should not hurt. It should only feel like a gentle pull. It should be for 10 seconds, 10 times. And that's a starting point. Cervical Isometrics, that's where you just take your hand and you push very gently. should feel the neck muscles engage in here. Isometric exercises are a good way to start with strengthening, especially if you're having problems moving. You hold for 10 seconds, you repeat 10 times. Again, pain-free. You should only feel those neck muscles working. If you're having a problem and this side hurts and you can't lift that arm up, just bring the other side around and do the same thing like so. Then finally, rows. If you can get access to rubber bands or TheraBands or any kind of exercise equipment, just doing some simple rows where you're pulling back, it helps open up the chest muscles, get them to stretch out because we're always like this, and it works on those mid-back strengthening muscles. And what I find is that the stronger your mid-back is, the stronger the front of your neck is, the better you are positioned to reduce stress and strain on the body. So you currently have three options to change your pain. You can come into our clinic for an evaluation. You could schedule a telehealth evaluation. Not all insurances will pay for a telehealth evaluation, so please call the clinic if you want us to check your benefits. What telehealth is that we talk just kind of like this on a Zoom type platform that is HIPAA secure, and it's a way for the therapist to kind of dialogue with you on what is causing your pain. Now, unfortunately, with the telehealth visit, we don't have the hands-on portion, but we can give you some evaluation on what's going on in your home, what's going on at your workstation. We can do some ergonomic work stuff with you, or we can just work with you on a home exercise program and kind of at least start you on the way to where when you feel comfortable coming into the clinic, we're ready to go. The third thing you could do is you could take the information that was in this presentation and you can just try to work with that, work with some of the exercises. And again, once you feel comfortable coming into the clinic, we are here. We follow all CDC recommended guidelines. We keep our patients 6 feet apart. All of our treatment tables are 6 feet apart. All of our therapists are wearing masks. Most of our patients are wearing masks. We are making it a requirement now. Sometimes with people exercising pretty hard, it kind of is a little bit of a problem, but we do our best. If you have any questions or comments, again, you can email Elise at cornerstoneptnc.com. You could go to our website, which is cornerstoneptnc.com. You can look up one of the therapists that are in the website, and it'll show the specific subspecialties they have. If you want to ask the therapist a question, you can click on that therapist with that subspecialty, and it'll email to them, and you'll be able to dialogue with them. If there's anything that we can do to try and help you out with any kind of orthopedic conditions, please let us know. And I hope you enjoy the rest of your day. And if there are any questions, you can let me know. And if not, thank you for your time, and I hope to see you soon.